The United States fight against the swine flu gets an $8.5 billion boost today with a sweeping federally funded vaccine program. It's just one of the things being hammered out today in a meeting with state, local, and federal leaders. The goal? To deliver a knockout blow to spreading swine flu cases that are frankly expected to uptick this fall. So, what's the plan? What will it mean for you and your family? We're going to get the inside information you need to know in just a moment when I talk to Health and Human Services Secretary Kathleen Sebelius and the new director of the Centers for Disease Control, Dr. Thomas Frieden. But first, Monica Novotny joins me from the news desk with the latest on H1N1, otherwise known as swine flu. Monica?
That's right, Nancy. We've been following the headlines coming into the newsroom this morning. Here's what we have for you. The World Health Organization says the pandemic's international spread is, quote, unstoppable. This number, 1 million and counting, that is now the estimate of all the U.S. cases, from those tested at the doctor to everyone who just stayed home and nursed the virus with chicken soup. Tamiflu-resistant swine flu is now the focus of a worldwide investigation. Doctors have diagnosed 3 people, 1 in the United States, 1 in Denmark, and 1 in Japan with this apparently resistant strain. But the CDC says it is not a cause for concern. Nearly 24 U.S. students are in quarantine in Japan over swine flu fears, and Argentina, they're shutting down banks tomorrow as the flu death toll rises rapidly in that country. Dr. Nancy, back to you.
Monica, thanks. We've been calling it swine flu. It's also officially known as H1N1, and boy, it has hit all 50 states. But there are 10 states that are considered hotspots right now. All of this and the global aspect is the genesis for today's meeting in Bethesda, Maryland. And joining us from that summit, Health and Human Services Secretary Kathleen Sebelius and the new CDC Director, Dr. Thomas Frieden. Thanks, and good to see you again, Dr. Secretary Sebelius. Thanks for joining us. And congratulations, Dr. Frieden. It's very cool.
Thank you very much.
So this is not your typical medical meeting. Homeland Security, Department of Education, National Institutes of Health, the Food and Drug Administration, Centers for Disease Control. It's enough to get a conspiracy theorist salivating. Secretary Sebelius, why everybody?
Well, I think that the people here today are reflective of the team that's really been working across government agencies on getting prepared and keeping aggressively focused on the H1N1 virus as it transmits around the country. So Homeland Security certainly has a role in leading other government agencies. The Department of Health and Human Services and our partner here at the Centers for Disease Control has the lead on the health mission. And we're here at NIH because science will let us determine what the most appropriate role is to keep Americans safe and secure. So we're thrilled to have state and local partners here today and begin to share what we know and what we anticipate coming in the fall, and hopefully they'll turn around and replicate this when they get back home.
A couple of interesting things that Secretary Sebelius just said, Dr. Frieden, what to expect in the fall, the fact that this is global. My daughter is studying abroad right now in Argentina, and she said it is crazy with the run-on in hospitals, not enough antivirals, and frankly, a lot of panic. So 2 questions. What are we learning from what's going on in South America, and how does that help us prepare, since they're in their winter now? How is that helping us prepare for our fall and winter?
It's very important that we track trends around the world, and the Southern Hemisphere provides the clue to what's most likely to happen in the U.S. in the coming flu season. What we're seeing is that still there's lots of H1N1. The pandemic strain is the dominant strain in many of the countries, or is one of several strains in other countries. We are not seeing a dramatically different pattern of illness and disease, which is reassuring so far. So not a larger proportion of people getting sick or dying, but that same thing that we saw here in some communities, like New York City, where I was health commissioner in the spring, with lots of cases and some people very seriously ill and tragically some people dying.
So, Dr. Frieden, give me an update.
That we track what happens.
Can you give me an update on the status of the vaccine?
Vaccine is being developed. It will be tested to see if it's effective, and we're hopeful that by mid to late fall we'll have the first doses of vaccine available.
You know, it's interesting that you mentioned into late fall because obviously some schools in this country are heading back in 5 or 6 weeks. I'd like to roll a soundbite from one of the school nurses who was really one of the first outbreaks, Mary Pappas from one of the schools
Francis.
In St. Francis.
St. Francis Preparatory School.
Yes, I'd like to roll this and listen to what she said.
That morning, they left their homes feeling well. Usually, the children, I didn't feel good in the morning, but my mom made me come. I had many children just looking like, pick me, because they didn't feel bad this morning, and they were genuinely scared.
So with schools just around the corner, with summer camps closing in this country, I think there are a lot of parents out there who wonder, Dr. Frieden, oh my gosh, if this happens to my family or my kids, how fast can I react?
There are a couple of things that everyone can do. If you're sick, stay home. Cover your mouth when you cough or sneeze, and wash your hands frequently. These are simple things that will protect yourself and protect others as well. As we go into the school season, we'll have to monitor carefully to see if there are problems, if there are outbreaks, and if so, what the best way to respond is. What we found in New York City was even if there were lots of cases in a school, it wasn't necessary to close the school if you could ensure that the kids who were sick were staying home and not infecting others in the school.
Secretary Sebelius, so much of our health care in this country is really on the local level, schools, clinics, and you really represent, the top of that triangle. How will you incorporate what you're doing to the very, very, very local levels? And can you reassure the American public there will be enough vaccine?
Well, Dr. Nancy, what we're doing here today is the first step in exactly what you're talking about, sharing the information from the top scientists, from the Centers for Disease Control, from the emergency preparedness folks with leaders of the state. And then we want them to go back and pull together their state and local partners, key mayors, health departments, private business partners, faith and community-based groups, and share this information so that we're ready for a vaccination program. I think we're confident that starting in mid-October, we'll have vaccine available, and we will have supplies as the fall rolls on. It all won't be available simultaneously, but we're looking at mid-October for a start date, assuming we have a safe and effective vaccine by then. So that what we want to do right now is stop the transmission of the disease. It's estimated we have about 1 million cases in the United States right now. We'd like to have people remember that today and tomorrow and the next day before school starts, we need to stop the transmission as much as possible, keep kids home when they're sick, wash hands, cover coughs, take the steps right now to see if we can shut down this virus from spreading any more rapidly.
And one final question. I certainly understand all the scientists who are there, but can you explain why the Department of Education, and even more so, why Homeland Security?
Well, Homeland Security by law is the lead federal agency in any kind of outbreak, any natural disaster, any health disaster. So Homeland Security is responsible for everything that's non-medicine, helping businesses prepare for alternative strategies in the event that lots of folks have to stay home from work, getting transportation lines clear, helping to drive the stockpiles out to the existing locations. So they have a very key role to play. The Department of Education is clearly a partner on potentially two fronts. One, working with us to see what we're going to do with school openings, school closings. What Arne Duncan, the secretary, said, we want to keep, hopefully, kids safe and secure, but also we want kids to continue to learn. So closing schools is the last option, not the first option. But also looking at a vaccine that might be targeted towards school-age kids. Schools can be a key partner in vaccination programs. So we definitely need to work closely with not only the secretary, but local school partners, which is why governors were asked to bring their school chiefs here, and we want to make sure that the education pipeline is wide open. This flu is targeting a younger population, school-age children, children in daycare centers, they transmit it and they also carry it. So we need to keep the school links very close.
Well, Secretary Sebelius, thank you again for joining us. And Director Frieden, congratulations.
Good to be
and thanks
with you.
for being with us, too. You bet. The Health and Human Services head is looking for help getting out the word on swine flu. So Secretary Sebelius is holding a contest to make the best public service announcement, and the winner gets $2,500. So if you want to win that $2,500 and do something that's good for the health and welfare of your fellow Americans, go to pandemicflu.gov to find out how to enter.